Okay. Tone was for a male patient. Called 911 claiming he'd fallen from a chair while changing a light bulb. 911 lost contact with the patient. We arrived on scene. It's a tipped over bar stool and a broken light bulb. Patient's lying, appears to be unconscious. Scene safe, BSI on. My partners maintain manual stabilization. First thing I'm going to do is begin assessing the patient's level of consciousness. Sir, can you hear me? Can you hear me? No response to verbal. No response to painful. I'm going to open the patient's airway and assess for breathing. Patient's breathing, 15 seconds, rate, rhythm, and quality. I'm going to check for a pulse. Patient has a pulse. Again, 15 seconds, rate, rhythm, and quality. I'm going to expose the patient's chest. Begin my chunk check. Looking for any bleeding. Nothing. Work my way down. No immediate life threats. I'm going to begin my 90-second survey or primary assessment. No JVD, no tracheal deviation. Auscultate lung sounds. Clear bilateral lung sounds. Sir, can you squeeze my hand? No response. Check a pulse. Check capillary refill. Tenting. Repeat on the other side. Can you squeeze my hand? Pulse. Capillary refill. Tenting. Check the pelvis. Palpate the 4 quadrants. The abdomen. Work my way down the legs. Assess distal pulse. Capillary refill. Babinski reflex. Repeat on the other side. Pulse. Capillary refill. Babinski. Nothing found at this point due to the patient's level of consciousness and my inability to locate any outward signs of trauma. I would activate an ALS response and activate a trauma team at the hospital. At this point, I'll begin my secondary assessment, which is a more detailed assessment while we're waiting for the ALS unit to arrive. Before I get to that point, I'm going to bring in a longboard, log roll the patient up on his side, palpate his back, log roll him back onto the longboard, and move him into the ambulance. In the ambulance, I would perform my secondary assessment. Again, checking for any BCAT, BTLS, JVD, tracheal deviation. I would again auscultate lung sounds, the 4 quadrants. Would check for bilateral expansion and work my way through. Can you squeeze my hand? Still no response. Capillary refill. Check for a pulse. Repeat on the other side. Can you squeeze my hand? No response. Capillary refill. Pulse. And tenting. Check the hips. Palpate the 4 quadrants of the abdomen. Work my way down, looking for any deformities or other injuries. Check distal pulse, capillary refill, Babinski reflex on both sides. And because this is a trauma patient, I would reassess every 5 minutes. That's in my